So we're talking all about dizziness and how it can arise from dysfunction within the neck. The concept for what I'm about to unpack in this video might make a bit more sense if I quickly run you through a fun little experiment. So close your eyes, and while keeping them closed, place your fingertip on your nose. Now, barring any type of underlying neurological disease or condition, you probably were able to place your finger directly on the tip of your nose without any issues at all. But how did you do that without needing to see where to place it? And perhaps more importantly, what on earth does this have to do with dizziness or using lasers to fix the issue? Well, stick around and let's talk all about sensory conflict, joint position error testing, and the dizziness that can result when our brain doesn't know what to believe. Now, just so we're clear, dizziness can arise for literally dozens upon dozens of different reasons, and it may well be that any dizziness you've been experiencing is from conditions completely different than the topic covered in this video, so please be aware of this as we move along. So when it comes to dizziness, your brain has different expert systems that help you to determine positioning information of your head and neck in relation to the rest of your body. But sometimes these systems can get out of sync, disagreeing with one another. And when this happens, it creates a condition known as sensory conflict. And one of the many symptoms that your brain produces when receiving conflicting information can be dizziness. So let's go back to our science experiment. How were you able to place your finger directly on the tip of your nose without needing to see where to place it? Well, in the process of moving your arm, your brain was gathering positional information from receptors in your hand and upper extremity that it relayed back to your brain regarding the location and positions that your hand and arm were in. This real-time feedback information is supplied by special little receptors in our body known as proprioceptors. And it's these little receptors that allow for our brain to feel and interpret the location and position in which our various body parts may be. The ability to feel and interpret this positional information about our body is known as proprioception. We have these positional receptors all throughout our body, including within our neck, which our brain relies on as a means to gather necessary positional information towards the orientation of our head. But we also have another sensory system that gives our brain feedback on the position and orientation of our head as well. And this system is known as the vestibular system. Normally, the information relayed to the brain from the vestibular system and the proprioceptors in the neck should produce the same information regarding the position of our head and neck. But if they're out of sync, so to speak, then the brain gets conflicting information and becomes unhappy, and it lets us know by producing dizziness. Think of it like two experts on a given topic giving you completely different answers to a question you have asked. You don't know who to believe since they're both qualified experts, yet they disagree with one another and therefore give you conflicting information. In a similar manner, this is why people can become seasick when on a boat. They look at the horizon and their eyes see a horizon that doesn't appear to be moving, but the vestibular system is bombarding the brain with different information, saying, "Nah, man, we're definitely moving here." And in other words, the motion you see with your eyes doesn't match with the motion your vestibular system is perceiving, which is a sensory conflict and can produce nausea as a result. So when we get a sensory conflict from the cervical proprioceptors and the vestibular system, we can get sensations of dizziness, and we need to not only determine if a mismatch between these two systems is taking place, but also to find a way to bring the two systems back in sync. And that's where lasers can come in. Joint position error testing, or JPE for short, is a way that we can test if there is a mismatch between the proprioceptors in the cervical spine and the vestibular system. It works by centering a laser on your forehead so that the beam emits directly in front of you, typically on a small target a few feet away. Then, while keeping your eyes closed, you move your head as far as possible in one direction, and then, as your eyes remain closed, you bring the beam back to what feels like the exact same position as where you started. And once you feel like you've got the beam directly back on the target, you open your eyes. If the two positional systems are in sync, then you should have aligned the beam back to the target, or at least very close to it. Now, if the beam is quite far off target, then it signifies that a mismatch is occurring. And the neck movements to test out here can be left rotation, right rotation, up, down, or even diagonal. And whichever movements you test, you want to test them repeatedly, since testing a movement multiple times will help to establish consistent patterns or trends with how poor or accurate an individual's cervical proprioception is. Testing each type of neck movement and direction can reveal some helpful information regarding which aspects of cervical proprioception may be struggling. And sometimes you'll find that every movement is off target, while at other times you'll see individuals who nail certain movements or directions, while other movements or directions are quite off target. And for any direction that's tested, the further away you are from the target when you open your eyes, the poorer your proprioception is, while the more precisely accurate you are, the better it is. Ultimately, if your ability to accurately return the laser to its original target is poor, it suggests there may be a proprioceptive deficit within your neck and may, and I will stress, may suggest that some or perhaps all of your dizziness may be due to this issue. There can be numerous reasons for what causes the mismatch, which can range from issues with the vestibular system itself, proprioceptors themselves, or some combination between the two. And it can get pretty complex, but for the purposes of this video, just know that there are numerous reasons for why this can occur. As one example pertaining to my line of practice, I often see patients in the clinic who have had their cervical proprioception greatly impaired due to motor vehicle accidents, which can cause various issues such as whiplash disorder and can subsequently impair and decalibrate cervical proprioception. Interestingly enough, I'll quickly mention that it's common to find a relationship between impaired cervical proprioception and neck pain, meaning that individuals with chronic neck pain tend to have poorer JPE scores than individuals without neck pain. It's pretty interesting, right? Now, I did want to talk more on the relationship between neck pain and impaired cervical proprioception, but for the purposes of this video, I'm focusing more so on the theory of sensory conflict arising within the neck and its potential involvement with causing dizziness. But yes, do be aware that there is a relationship between chronic neck pain and poor cervical proprioception. Thankfully, we can often retrain and recalibrate cervical proprioception, which can help eliminate any dizziness that may be arising from this particular mismatch. And one of the ways to do this is to repeatedly practice the joint position error test. Traditionally, this involves using a specialized headpiece with a laser pointer configured in such a way that the testing can be carried out. But what my colleagues and I have done over the years is we've used a ball cap that's traditionally used for golfers, known as a laser cap. Now, my understanding is that this cap is traditionally used to help golfers control their head when swinging clubs and putting, but these things also work brilliantly for joint position error testing and retraining. And while there's no single universal way or protocol to go about retraining cervical proprioception, you can repeatedly practice the JPE as one way to do so. And here are some considerations. Like most other things, the process will involve consistently practicing the task you're trying to improve. And the process itself ultimately comes down to checking and rechecking what you feel is accurate head and neck positioning compared to the actual result you produce, and allowing your brain to learn from each attempt. Starting with very small ranges of motion tends to make it easier to determine neck positioning. And as you practice and improve your accuracy using the small ranges of motion, you can gradually scale up to larger movements. Performing a couple of movements with the eyes open and then a single repetition with the eyes closed can also be helpful. It's almost like taking a practice swing or two when swinging a golf club before actually hitting the ball. Keeping all movements slow is also a good idea, since this allows the brain more time to interpret what's occurring at the neck in terms of movement and position. Naturally, if you're having any dizziness, it's best to work with a qualified healthcare professional who can help you determine what's causing the underlying issue. If it's due either in part or wholly to a lack of cervical proprioception, there can be ways to get the issue cleaned up. And it's entirely possible that if you have chronic neck pain, getting the pain under control will in itself help with proprioceptive issues. Now, there's so much more to unpack than what I'm able to cover in this video, but my hope is that this little primer can help to not only point you in the right direction for how to improve cervical proprioception, but also to appreciate just how complex and remarkable the human body truly is. And if you thought any of that was cool, then check out this video right here, which will show you some more cool stuff about physical rehabilitation that you may find to be rather helpful. And in the meantime, keep making great things happen.